Imagine you wake up this morning feeling completely fine. You make your coffee. You sit by the window. Everything feels normal. Everything feels okay. But right now, as you sit there, the pressure inside your arteries is quietly tearing microscopic wounds in your blood vessel walls. You feel nothing. No pain, no dizziness, no warning. This is happening to nearly half of all adults over 60, right? Now today, doctors call it the silent killer, because the first symptom, for too many seniors, is a heart attack, or a stroke, or kidney failure, all while they felt completely fine. I am going to show you exactly what high blood pressure is doing inside your body right now, what your numbers actually mean, and the 5 daily habits that can bring those numbers down starting today. No medication required. Stay with me. This one could save your life. Most health problems warn you. A broken bone hurts immediately. A chest infection makes you cough. Even a cavity eventually causes pain. High blood pressure gives you nothing. Absolutely nothing. Until one day, it gives you a stroke. Here is how serious this is. High blood pressure is the leading cause of preventable death worldwide. Not cancer, not diabetes, blood pressure. It affects 1.28 billion adults globally. That is more people than live in North America, Europe, and Australia combined. And nearly half of them have no idea their blood pressure is dangerously high. Now here is what it is silently doing to 3 parts of your body right now. Your heart. It has to push against higher resistance every single beat. Over years, it enlarges, it thickens, it weakens, and one day it gives out. Your brain. High pressure damages the tiny blood vessels feeding your brain cells. This accelerates memory loss and dramatically increases stroke risk. Your kidneys. They filter your blood through thousands of tiny vessels. High pressure scars those vessels, causing kidney disease, which itself raises blood pressure even further. A dangerous cycle, all 3 organs silently, every single day. Now let me give you something genuinely useful. Something your doctor probably has not taken the time to fully explain. Those 2 numbers on your blood pressure reading, what do they actually mean? The top number, systolic pressure. This is the pressure when your heart beats and pushes blood out. Think of it as the push number. The bottom number, diastolic pressure. This is the pressure when your heart rests between beats. Think of it as the rest number. Both numbers matter. But for adults over 60, doctors watch the top number most closely. Here are the 5 ranges you need to know. Normal, below 120 over 80. This is your target. Elevated, 120 to 129 on top. Below 80 on bottom. Not yet high blood pressure, but your body is sending a signal. High stage 1, 130 to 139 on top, or 80 to 89 on the bottom. This is where lifestyle changes become urgent. High stage 2, 140 or above on top, or 90 or above on the bottom. At this stage, most doctors discuss medication. Hypertensive crisis, 180 or above on top, or 120 or above on the bottom. This is a medical emergency. Call your doctor or go to emergency immediately. Here is the number I want you to remember. 130 if your top number is consistently above 130. Not once, not on a stressful day, but consistently. Your heart is already under more strain than it should be. That is not a watch and wait situation. That is an act now situation. Now here is the part that should genuinely encourage you. High blood pressure responds to lifestyle changes faster than almost any other condition. Some people see meaningful improvement in just 2 to 4 weeks. Here are the 5 habits that research consistently shows work best. Habit 1. Cut sodium from packaged food. Not your salt shaker. Most seniors get over 70% of their daily sodium from processed food, canned goods, and restaurant meals, not from the salt they add at the table. Checking labels and targeting under 1,500 milligrams can lower your systolic pressure by 5 to 6 points. 1 practical swap: replace regular canned soup with the low-sodium version. That single change cuts 600 to 800 milligrams of sodium from 1 meal. Habit 2. Walk 30 minutes a day. Not a gym, not a personal trainer, just walking. Studies show brisk walking lowers systolic blood pressure by 4 to 9 points on average, equivalent to the effect of some blood pressure medications. If 30 minutes feels too much, break it into two 15-minute walks. The effect is the same. Habit 3, eat more potassium. Potassium directly counteracts the effect of sodium on your blood pressure. Bananas, sweet potatoes, spinach, avocado, all excellent sources. One banana a day is not a miracle, but it is a real measurable habit that adds up over weeks. Habit 4, limit alcohol to 1 drink or fewer. Even moderate regular drinking raises blood pressure measurably. This is not about being dramatic. If you enjoy a glass of wine in the evening, 1 glass is the line. Beyond that, the effect on your BP becomes significant. Habit 5, 5 minutes of slow breathing before bed. Breathe in for 4 counts, out for 6 counts. This activates your parasympathetic nervous system, the part responsible for rest and recovery. Clinical studies show this simple practice lowers blood pressure meaningfully over time, completely free. Takes 5 minutes. You can do it lying in bed tonight. Inhale 2, 3, 4. Exhale 2, 3, 4, 5, 6. That is it. Now, a word about blood pressure medications. If your doctor has prescribed medication, please keep taking it. Do not stop based on this video. Blood pressure medications save lives. That is a fact. But here is what many seniors do not know. Blood pressure medication controls the numbers. It does not fix the underlying cause. You can take medication and make lifestyle changes. In fact, that combination is the most effective approach. And here is something genuinely encouraging. Many seniors who commit to these 5 lifestyle habits consistently for 3 to 6 months find their doctor is able to reduce their medication dose. Some are able to come off medication entirely under doctor's supervision. That is not me saying to stop your medication. That is me saying lifestyle changes are powerful enough to change your prescription. Talk to your doctor. Show them this list. Ask, if I do these 5 things consistently for 90 days, can we reassess my medication? That is a conversation worth having. Let's bring it all together. High blood pressure has no symptoms. It is silently damaging your heart, brain, and kidneys every single day until it causes a crisis. Your blood pressure numbers decoded below 120/80, normal, above 130 on top. Act now, above 180 on top. Call your doctor immediately. The 5 habits that bring numbers down. Cut sodium from packaged food. Walk 30 minutes daily. Eat more potassium. Limit alcohol to 1 drink. 5 minutes of slow breathing before bed. Your one action from today. Measure your blood pressure this week. If you do not have a monitor, go to your pharmacy. Use their free machine. Write the number down. Just knowing your number is more than most people ever do. If this video helped you, share it with someone you care about who has never checked their blood pressure. It might be the most important thing you do for them this year. Subscribe to Vital Years for a new video. You will not want to miss that. See you next week.